Welcome everyone to the third episode of our podcast, Mind Matters. My name is Tanuj Sharma. I'm co-founder and CEO of Kana Health, where we are focused on transforming therapists into super therapists by equipping them with the AI-based clinical decision making. As we all know, therapy is an incredibly fulfilling profession, but it also comes with its own set of unique hurdles that can make the day-to-day life difficult for therapists to navigate. We'll dive into some of those challenges today in our podcast. We'll explore how technology can play a role in supporting therapists, improve patient outcomes, and also make the profession more sustainable. I'm thrilled to have Nidhi call with me today. She is a licensed therapist and coach to explore these challenges which therapists face in their day-to-day life and how innovative solutions like Kana can alleviate some of these pain points. Nidhi, welcome.
Thanks, Tanuj. I'm looking forward to having this conversation with you and to exploring how Kana can support therapists.
Well, thank you, Nidhi, for joining us today. Let's dive right in. My first question for you today. What are some of the biggest challenges therapists face?
So, Tanuj, there are many challenges that therapists face, and I can speak to some of them today. But before I do, I want to note that my perspective is informed by my experience working at Kaiser Permanente and in private practice, and that, of course, my colleagues may have additional insights based on their experience. But now to get to it, one of the challenges that we therapists face, which I can safely say all therapists experience, regardless of the setting of their practice, is the emotional demand of our work, the compassion fatigue. We care deeply about our clients and their well-being, and so it can be hard when we hear and see our clients struggling in life. When a client is crying in a session with me, my heart feels for them, and I not only have to regulate my emotions in the session, but also after the fact so that I can be present for the next client. It can be really hard to emotionally attach and detach in a way that serves the client, serves myself, serves my other clients, and other people that are in my life. And I know that many therapists who talk about feeling emotionally and physically drained at the end of their day, so much so that they can't find it really hard to be present with their own families. And I experienced this as well. And another facet of that emotional demand is the level of responsibility we feel for our client's success and setbacks. It can be hard to assess if the outcome isn't being achieved because of our treatment approach, of something we are doing wrong or not so well, or because of the client's level of engagement and readiness. And it can be easy to take on too much responsibility for our clients' outcomes, which of course, as you can imagine, can take an emotional toll on us. Another part of what makes this profession challenging is the isolation that it comes with. We're alone in our sessions with clients, and often we don't have time to connect with other professionals in the same field. We have to make a concerted effort if we want that feeling of camaraderie or team support. And that's very difficult to do with the large number of cases, a large caseload of complex cases that we often carry. So if a clinician is seeing 7 clients in a day, they don't have much time for anything else. The remaining time is saved for admin work, so it becomes challenging to provide support to one another. I remember when I was new to the field over 10 years ago, how overwhelming it felt to manage a caseload on my own. I had access to a lot of support from incredibly qualified people at Kaiser, but finding the time to actually access that support was challenging. When I was free, they'd be in a session and vice versa. So it was hard to find time to connect. And when you're new to the field, as it is in any profession, there are feelings of inadequacy and incompetency. And these are triggered even more when we don't have the time to access support from other colleagues who could normalize these feelings and provide mentorship. And another challenge that I'll speak to is the financial instability that many therapists experience. In general, mental health is not a profession that pays well. And on top of that, therapists who choose to start a private practice can experience a lot of income variability week to week because their income is directly dependent on how many clients they meet that week. So if they contract with insurance companies, there may be some stability, but the reimbursement rates are so low that they have to pack their schedules with back-to-back clients to make ends meet, which can be draining. And unfortunately, there are times when they aren't even reimbursed for the sessions, or they have to spend excessive time following up with insurers to make sure they are paid for their service. So that can be challenging and really disheartening for therapists.
Wow. I mean, you packed in a lot of information in there, Nidhi. Really appalling to, hear some of those terms which you use, and we keep hearing about the compassion fatigue, the transference, counter-transference, and, I mean, what you just shared kind of throws a lot of light and details into some of those, things which we hear about. Really appreciate that perspective, Nidhi. My next question really is, we often hear therapists mention that the administrative load is high and, back office functions like billing, invoicing, claims take a lot of toll on their time. What are the strategies that have you found effective in handling these tasks, and where do you feel there is room for improvement, especially leveraging technology?
Yeah. So first, I just want to highlight what we're speaking about when we talk about that admin load or the unbillable work. What that looks like is the time that we spend on invoicing clients or submitting insurance claims. It's the time that we spend on documenting and maintaining patient records that have to meet legal and medical criteria. It's time spent on consultation calls with other therapists or specialists and complimentary initial consults. And it's the time that we spend messaging with clients outside of sessions or thinking about them and reflecting on the sessions and what could be appropriate the next time that we meet, the approach that we need to take. So all of these tasks are unbillable. And I'm sure that there are more that other therapists would add. But some of the strategies I use to both manage my time as well as these admin tasks are having strict time boundaries. So I'm generally a very punctual person. And with sessions, I really do try my best to start and end my sessions on time. Of course, there are times that I may be late or go over with a client, but in general, those time boundaries allow me to have time to document or to engage in whatever self-care activity I need to in between sessions. And then another strategy, which I learned from another colleague, is to type my initial intake note during the session itself. So I do that for return notes, but specifically when I meet a client for the first time, there's just a lot of information that I'm gathering. And so if I don't do it right in that session, it's going to take me about 30 to 60 minutes after the session to complete them. And that again is time that is unbilled, that I don't get reimbursed for. And that's time I could be meeting with another client, which I'd rather be doing. And then to make my billing easier, I've contracted with EAP providers like Lyra and Spring Health, and they simplify the billing process. And then for private pay clients, I use like electronic health record platforms billing. But again, they take 3% out of each invoice that I create. So that's not necessarily a perfect fixed or solution. So you asked that question, where is there improvement or room for improvement? And I'm sure that there's several areas. I can speak to a few. And I think, it also depends on the setting a provider works in, whether it's in a private practice or whether it's in a healthcare setting, that they would have additional insights to add. But I will say many therapists complain about how challenging it can be to understand and explain insurance reimbursement and how that can be a barrier to treatment for some clients. So help in understanding like reimbursement rates, improving reimbursement rates, and in general support with billing would be useful. And then support with marketing and finding clients that are the right fit for our approach and specialty is another area. A lot of our admin time can go into figuring out how to market ourselves. And most of us don't have much training and don't feel competent in doing this. So it'd be great to get support around finding the right clients for what we have to offer and our experience. And then lastly, documentation support would be another area of improvement. Writing client notes can take a lot of time, especially if you are submitting a claim to an insurance company, because you have to make sure that your note verifies that the client is meeting medical necessity for treatment. So it would save a lot of time if we had pre-populated templates or some guidance on how to document well so that we are reimbursed for the services that we provide.
Wow. Okay. And that's precisely, the point of, the AI which we have built with therapists as a center of our universe, right? To remove that cognitive burden. And cognitive burden is everything which takes your time away from focusing on patient And that is precisely what we are trying to solve, using Kana's AI, reduce therapist burnout by, automating some of those patient engagement activities, enabling more personalized treatment recommendations. We want to remove the back office burden through AI powered documentation, super bill generation, CMS 1500S, patient summaries, patient statement. And we can even integrate with insurance companies to reduce that time which is spent on, following up on insurance claims, filling up those insurance claims, removing those errors, whether, why did the claim not go through and stuff like that, so that therapists can really just focus on their patients and less spend less and less time on these administrative work and burden which is really on them. Wonderful. Moving on, Nidhi, to our third question. As you just mentioned, there is a lot of income variability, especially when dealing with insurance companies. It can be really frustrating for many therapists. Are insurance companies really playing ball these days? And I know things have changed since COVID-19, but do they still see mental health as a redheaded cousin of healthcare? How are therapists managing the low reimbursement rates and complexity of insurance paperwork and claim?
Yeah, I think you spoke to that a little bit, just in sharing how Kana can be supportive. But what I'll say here is that there was actually an article published a month ago by NPR, and it was commenting on this very issue. The article discussed how insurers shortchanged customers with mental illness by restricting coverage, delaying coverage, and denying care. And it also confirmed that therapists in network with insurance companies receive low reimbursement rates. Um, and that these therapists often have to jump through hoops to get paid for their work.
Yeah.
And, again, we're not getting, we're not able to bill for those hours. So we're spending hours on the phone trying to follow up with insurers to get paid for the service that's being provided. And if the patient's notes don't meet the criteria for medical necessity, or perhaps they're incomplete, a signature is missing, a date is missing, anything is missing, then sometimes they may be even asked to refund the money to the insurer. And so that creates a lot of income variability because you don't know when you're going to be asked to repay back what the insurance paid you for the treatment. And so, quite frankly, a lot of therapists like myself choose not to be contracted with these insurance companies because the amount of additional work required just isn't worth the trouble. I wouldn't want to risk providing treatment that I don't know if I'm going to get reimbursed for.
No, I can imagine, Nidhi, and that is what we are trying to solve, in Kana as a platform, that how do we provide those statistics that the patient is showing signs of improvement, that there is a tangible patient outcome which has been done and delivered by the therapist, and it becomes easier for the therapist to report that data points and statistics back to the insurance company so that they can prove that the patient outcomes are actually delivered. And that is why, I deserve better reimbursement rates, and, my overall, income variability should be reduced. I should be paid more for driving better patient outcomes. And, collecting all of those data points, reporting those statistics is the intent of our platform, to make those things easier for the therapists to perform and operate on.
Yeah, and I think it'd be really valuable, Thanuj, not to cut you short, but if we have that kind of like an auditor in some ways, or an adjunct to the service that we're providing, where someone to let us know what is the criteria for documentation, and as you said, be able to give us the data that we can then use in our documentation that is very valid and reliable to support our claim for providing treatment. That would actually encourage more therapists to get contracted with insurers. Right now, a lot of therapists are breaking their contracts because they don't feel like they're getting reimbursed fairly, and they don't want the unpredictability of not knowing when they're going to be asked to refund a claim.
No, you're spot on, Nidhi, and that is what we hear, when we talk to a lot of therapists, that there is clearly a standoff between, value-based care, insurance companies, and therapists, because, there is a lot of demand on therapists to show data, show statistics, show the patient outcomes. while there is no software or a platform which has been provided to them to report that data and analytics and status and patient outcomes. And that is what we are trying to solve for, that hey, this is the platform which can help kind of resolve this conflict and make more therapists become part of the network and join the insurance plan. All right. Having said that, we also want to talk about another very important topic which therapists face a lot, which is burnout. What strategies do you think you have developed for yourself or other therapists will find effective in preventing burnout, or at least reducing or mitigating burnout to an extent?
Yeah. So, for me, balancing my schedule and workload has been the most impactful in
Yeah.
preventing burnout. And what that means is making sure I don't have more three back-to-back clients at a time, for
Yeah.
example, on any given day, and that I leave time for admin work and self-care every day. It also means being mindful of how many clients I see in a day, in a week, as well as the acuity of those clients on any given day. Because there are certain clients that I might feel more triggered by emotionally, and I want to make sure that I am as present and engaged in those conversations as possible. And what that requires is that I balance those clients with ones that may be requiring a little less from me emotionally, based on where they are at that particular time. And so that's one thing that I'm mindful of, is just even the acuity of clients on any given day. And then, having a full day of client sessions can be really overwhelming and exhausting. So I try to create variety in my schedule by doing group work, speaking engagements, or consulting. And just creating that variety helps me be more present and more engaged in my client sessions. And it helps me feel more balanced at the end of the day. And then I know that other factors that can help, or consulting with colleagues. I often, message with a colleague if I have frustrations that come up, whether it's billing, whether it's just feeling burnt out. I will reach out to my colleagues for support. And spending time with friends and family, exercising, doing some of those self-care practices that can balance other parts of your life. And one thing about burnout, Thanuj, is that burnout often is caused by a lack of control or agency, or that feeling of lack of control. And in private practice, I will say you have a lot of agency and you do have a lot of control over the schedule, over the clients you see. Other healthcare settings, such as working at Kaiser, or perhaps working at PAMP, or any of those clinics where therapists may not have as much agency, like trying to find ways to get that sense of agency is going to be important. Whether it's advocating for how many clients you can see in a day, whether it's advocating and asserting boundaries on certain conditions that you are unwilling to see because that you don't specialize in it. Unfortunately, some clinics require you to be a generalist, meaning that even if you don't have expertise in substance use treatment, you may be required to support somebody that's experiencing substance use issues. And that feels unethical. It just doesn't sit well. It can create a lot of feelings of incompetency, inadequacy, and just generally, that's not what we went into the field for. We want to support our clients to the best of our ability. So when we come back to burnout, being able to assert what you want, what you need, is going to be helpful in those types of settings where you may not have full control over what you're doing on a day-to-day basis.
No, well said, Nidhi. And if I were to recap our conversation today, there are a ton of challenges, as we heard, in front of the customers. Compassion fatigue, cognitive burden, and making sure that you're engaged at all time. Taking care of your own, well-being and state of mind is equally important. When it comes to back office, there is huge amount of paperwork which needs to be done. The insurance companies have their own demand, the data, the statistics, proving the patient outcome, generating all of those documents. So the life is tough, and that is precisely what we are trying to solve with Kana. we can see the future that Kana's AI will be able to provide real-time insights, automate a lot of those tasks like note-taking and billing and insurance claims, so that we can really free up time for therapists from these cognitive burdens and, really help prevent that burnout. And we really want to, make sure that therapists have enough time to focus on what is truly most important part of their, job, is building that bond of trust and understanding with their clients, and really understand their client more and more deeply. And rest everything, AI and our platform, Kana, can take care of in terms of engaging with the patient between sessions, tracking their progress, ensuring continuous care, and ultimately, we believe, Kana can enhance therapist efficiency, accuracy, enabling more personalized and effective mental health treatment.
Wonderful. I'm excited to see, what the outcome is and to use Kana when it comes out.
Well, thank you, Nidhi. Really, really appreciate that. And we are looking forward to more such insightful conversation. It has been a pleasure speaking with you today about the challenges therapists face and how Kana can solve some of these. As we have heard, the need for support is real, and with the right tools, we can make therapy more sustainable for professionals while ensuring better outcome for patients. Thank you, everyone, for joining us today. And for all of our listeners, if you want to learn more about how Kana is transforming mental health care, please check out our website, www.kanahealth.ai. See you until next time. Thanks, everybody.
Thanks, Thanuj.